Hello to my fellow nursing peers, this is Sarah Horvath. We've made it to week 7 of the ABS program, and I'm amazed at how much material we've already worked through. I think we've built a strong base in this course about nursing professionalism, and I'm here to talk about the beginning of my journey. My nursing philosophy continues to develop. One of the most important points for me is to treat each patient as a whole person, rather than merely a sick body with a set of symptoms that I need to attend to. I believe that mind, body, and spirit are all interconnected. I want to be a patient advocate and stand up for my patient's needs, especially when he or she is unable to do so. I want my positive energy to be contagious in a way that uplifts my patients in times of sickness and distress. There are surely concrete tasks we need to accomplish every day as a nurse, but certain ones do not go on the chart. As Val Sainsbury said, nurses dispense comfort, compassion, and caring without even a prescription. I aim to incorporate these intangibles into my plan of care every single day. The human being becoming theory, as developed by Rosemarie Rizzo Paris, aligns with my nursing philosophy. I'm drawn to the part of her theory that talks about transcendence. Human beings refers to reaching beyond one's limits. A person is constantly transforming him or herself. As a nurse, I always strive to be the best version of myself, and I have to keep in mind that my patients are doing the same. Just because people are mainly in the hospital to restore physiological health, they still have ambitions and goals for their life, and I need to respect these fully. People are continuously interacting with their environment, which contributes to their hospitalization as well as affects their behavior while they're here. Just like Paris, I always want to be mindful of the wholeness of a person. To keep with the same theme, I'm definitely interested in the American Holistic Nurses Association. I am very interested to find an outlet to incorporate my background of athletics into wellness. Keeping the body in optimal shape through exercise and nutrition is extremely important in promoting health and preventing disease. Perhaps talking to like-minded individuals would be best, and this association has a chapter in Western New York with a student membership option. If I join, I can go to meetings, workshops, receive the monthly publication, and have access to online databases that will help me incorporate my philosophy of nursing into my academic work. I'm considering joining in the fall when our coursework slows down and I'll have a little bit of extra time. Nursing associations are important because the collaborative effort of many usually beats the individual effort of one. I believe that nursing is both a practice and a discipline. As confirmed by the University of Central Arkansas, nursing is formed by empirical knowledge as well as hands-on skill. Nursing cannot just be practice or just discipline. As a nurse, I have to fully understand why I'm doing something as well as use a proper, safe technique. Acing written tests in school is not enough, nor is being a pro at giving an injection. 3 issues in the contemporary nursing environment are lateral violence, mandatory continuing education, and professional identity. Lateral violence is something that many people have warned me about, as the nursing profession is notorious for bullying. Everyone on the healthcare team should be on the same page, and giving another coworker attitude or demeaning them is not something I want to partake in or stand for. I know that when nurses do not look out for one another, the patient is truly the one to suffer. I think I can combat this issue by being an open communicator. Additionally, I should address problems with coworkers right away instead of letting them fester. Even at clinical, there may be some nurses who will put me in situations that I am not comfortable with, but it is in my power to admit that I need help or further direction, even if I have to step outside of the patient's room to talk. We also debated about mandatory continuing education in the online course. I think that as a professional, I will be open to lifelong learning so that I can provide the best care possible to my patients. I am interested in being an educator myself and would encourage other nurses to join me at seminars and workshops. The professional identity of nurses is also a concern for me. I think our generation should work to get rid of the cycle of bullying in nursing because it contributes to burnout and gives our profession a negative image. Nurses need to band together rather than bring each other down if we want to keep developing as a group. Furthermore, I think the stereotype that nursing is a female profession should be combated by encouraging more men into the field. I would be interested in holding information sessions and talking to students at the high school level. I could even ask a male coworker to speak to the boys about how much of a critical, hands-on profession nursing really is. Bringing more men into the field would provide for different, evolving perspectives on nursing and help reverse the nursing shortage. Compassionate, kind-hearted, ethical, strong, honest, leader, team player, diligent, genuine, resilient. These are all adjectives that I want to be described by. I want patients to fully trust me and know that I will do everything in my power for them. I want to be both a leader and a team player in one, never being too proud to ask for help while also setting an example for other nurses. As time goes on, I know that my confidence will build. I think that one nurse's hard work and compassion can have a ripple effect and spread throughout the floor, and I hope I can make positive waves. I have a very open mind for the first 3 to 5 years of my nursing career. I want to get exposure to as many patient populations as possible. I would like to spend my time working in a hospital as well as also gain experience in some type of outpatient clinic. At this time, there is not one field that I am specifically drawn to. My main past experience is in memory care, working with elderly patients with dementia, and I thoroughly enjoyed this opportunity. I could see myself working with this group of people in the future and continually searching for ways that I can improve their quality of life. Another option that I find intriguing is being a nurse educator. At my clinical at Millard Fillmore Suburban, a nurse educator approached the nurses on our unit and gave them a 5-minute crash course on the Call Don't Fall initiative. She explained that every fall costs the hospital around $30,000 and asked the nurses to each give ways to reduce the amount of falls on our floor. I believe that this teaching was productive, and I had patient safety on my mind for the rest of our shift. I could see myself in the role of improving healthcare settings, which benefits the nurses, patients, hospitals, and really everyone involved in healthcare as a whole. During my first 3 to 5 years and throughout my career, I want to value self-care to a great extent. I truly have a passion for volleyball, working out, and nutrition, and would never want to let these slip out of my life. If nursing ever starts to become draining to me and detracts from my personal and psychological well-being, I will know that I need to find a different avenue, unit, or facility to practice. Nursing is such a broad field, and I expect to change up my setting many, many times. I feel as though I have already experienced growth in these first 7 weeks as a nursing student, filled with both challenges and small victories. I'm excited to see what the future holds.